Okay, so for today we're going to be looking at number 25 in the circulation problem set. And this is a complicated situation where a patient has pulmonary edema and we're treating them with two different drugs. A cardiac glycoside, which it tells us will increase the heart contractility, and also a peripheral vasoconstrictor, which will increase the systemic vascular resistance. And so we're asked what effect this dual treatment would have on three different factors: our CVP, our diastolic blood pressure, and also our heart rate. So this incorporates a lot of the different concepts that we've learned in the circulatory series of lectures. So what I'd like to do first is draw up our big picture of the circulatory system so that we can then start comparing what would be happening to each of these factors when we're given drugs. So we'll just draw up a generic version of our heart here at the top of the screen. And then we're going to show all of our blood vessels and the systemic circulation as one big circle and returning to the heart. So our arteries would be leaving the heart. We'll draw our capillaries as being at the bottom of our screen. And our veins would be returning the blood to the heart. So when we were looking at our big picture, there were really three different things that we had to talk about. We had to talk about how much fluid was actually leaving the heart, and we measured that through our cardiac output. We talked about our run-through. So how much blood is passing from the arterial to the venous side. And the last thing that we talked quite a bit about was our filling pressure. So what pressure is promoting that heart to refill from the veins? So let's start talking about these two different drugs that we're giving and how it would affect each of these factors. So the first thing that we're told is that there is a cardiac glycoside that's given. And it's given to us in the stem that would increase the heart contractility. So in other words, we're increasing the calcium inside those cells and allowing the heart to pump more efficiently. Now, you'll recall from our lectures that when we calculate the cardiac output, it equals the heart rate times the stroke volume. And since we've increased the intracellular calcium and we've increased contractility, this would increase our stroke volume, thus increasing our cardiac output, or how much blood we're pushing out into the arteries of the body. All right, now our second drug that we're given is a peripheral vasoconstrictor. Now, in order to understand how this would work, we have to think a little bit about our anatomy and where this peripheral vasoconstrictor would primarily be working. We know that one of the primary sources of resistance in the circulatory system is at the arterioles. So what we have here would be constriction of arterioles. The way that we would actually measure this is as the total peripheral resistance, or we know another way that we refer to that is the systemic vascular resistance. So what we've done with our peripheral vasoconstrictor is we've basically decreased our amount of run-through. We're constricting there at the arterioles, so even though more blood's coming out of the heart with our increasing cardiac output, we have less blood that's actually being pulled through the system back to the venous side. So we know that as a result of our peripheral vasoconstrictor, we've decreased our run-through. So this is the basic setup. Now we need to start thinking about what effect would these different indices have on our three factors that they mentioned, our CVP, our diastolic blood pressure, and our heart rate. So there's two main things that we've done here. One that we already saw is because of our cardiac glycoside, we've increased our cardiac output. We also know that we have, because of our peripheral vasoconstrictor, increased our TPR, so there's less run through from the arterial to the venous side. So now we need to think about what would this do to our CVP, and also what would this do to our diastolic blood pressure. Well, with the CVP, that's going to be our filling pressure. So in other words, what we're measuring there is the filling pressure of the heart. Now, because we've increased our cardiac output, more blood is being pulled over to the arterial side. And because we've decreased our run-through, there's less blood that's being pulled to the venous side through the circulation. So both of those factors together would decrease our CVP. So we already know that one of the factors is going to decrease our CVP, or our central venous pressure, is dropping because we've increased cardiac output. We've also decreased our run-through because of this increase in peripheral resistance. So then we have to look at our diastolic blood pressure, and we have to think about where is that measured in our system. Well, diastolic blood pressure is the lowest pressure present in a cardiac cycle, and that's measured in the arteries. So we're looking for the lowest pressure in our arteries. Now, because our cardiac output has gone up and our TPR has gone up, that would increase our arterial pressures. So we should see an increase in our diastolic blood pressure. So just based on that, we figured out two of our different factors, what would happen to them. So the only one we have left to determine is the heart rate. And for the heart rate, we have to reason through this one a little bit more. And we have to think about what would be one of the main receptors that influences our heart rate. And we learned in class that one of the main receptors types that would be doing this are the baroreceptors. And you also have to think about where these receptors are. They're located in arteries. We saw that the two main locations would be in the aortic arch and the carotid sinus. And we've already seen that all of those arterial pressures are high because we've increased cardiac output and at the same time increased our TPR. So these baroreceptors would sense an increase in pressure, and they're going to start signaling to the medullary cardiovascular center. That we need to bring our pressures back down. So we would see an increase in our parasympathetic nervous system output from the cardiovascular center, a decrease in our sympathetic output, and those effects together would help to decrease our heart rate in an attempt to bring our arterial pressures back down to normal. So, if we look at our three different results that we have a drop in our CVP, an increase in our diastolic blood pressure, and a decrease in our heart rate. So if we go back to our answer responses, what we're seeing is that one of our factors has increased, the other two have decreased, making response D the correct answer. So as you can see, this is a problem that was very complicated. It required you to utilize a lot of the things that you've learned about in the circulatory series of lectures. So hopefully this helped to solidify and clarify a lot of those issues. And as always, please let me know if you have any more questions about this material.